guys, today we're going to be interviewing Dr. Cedric Spak, MD, NPH. Dr. Spak is a transplant infectious disease specialist with extensive experience in opportunistic infections and immunocompromised hosts available for same-day inpatient and outpatient consultations. He works at Baylor University Medical Center of Dallas.
Thank you, Dr. Spak. We're so excited to have you here today. We're going to go ahead and get started with our first question. So currently Omicron cases are declining. Would you still advise healthy individuals to isolate as much as possible, and what other precautions do you recommend for healthy young individuals?
As we're in the almost second year of this pandemic, I think what everyone is kind of most frustrated with is how the recommendations change almost on a weekly basis. With Omicron, the question being of what should we do with cases finally coming down, and what should interactions be between individuals. I think it has to do with sort of like the overall risk of those young individuals. We still are seeing cases of people who are getting SARS coronavirus 2 infection in the setting of severe immune compromise, and there can be person-to-person transmission from family members. And we're still not exactly sure how best to protect those most fragile individuals. Like when we see them in the hospital, people who've gotten kidney transplants, they have leukemia or other sort of immune modulatory therapies. I think as the pandemic evolves over the next few weeks, that we will have a better idea of what can be done. Fortunately, the cases are going down. So I gave you a long answer, but I think young people who are at low risk should be able to have more interactions and sort of distancing and isolation techniques may actually get modified a lot over the next few weeks as authorities continue to look at the data.
Mm-hmm. And you were talking about seeing people in the hospital. From your perspective, how does the emergency room currently look right now regarding COVID cases? And are most cases moderate or pretty severe?
Within the hospitalized setting, we have a wide spectrum of patients with SARS coronavirus 2 tests that turn positive. And this will usually be just used kind of, I say this person has a positive COVID test. If individuals come in and they're unvaccinated, they can be extremely ill. It seems to be exactly the same thing that we witnessed at the beginning of the pandemic, that individuals who are young and unvaccinated could have anywhere from no symptoms to catastrophic illness requiring full-scale ICU support. Within the emergency rooms, about 2 weeks ago, things were really vicious. It was very, very busy. There were patients in hallway beds. It was starting to feel almost like a disaster setting. The last 3 days with the heavy snow and winter actually made it hard to get to the hospital. So I'm not sure what's going to happen over the next couple of days.
So with that decline that we're seeing right now, should young people still wear masks in large settings and isolate?
So masking and isolation are two different questions. Masking really is basically a risk reduction behavior. It is remarkable how scientific endeavors and scientific interventions can then sometimes get hijacked by political conversations that have nothing to do with science. When we look at the utility of masking, there is a social aspect of masking which is above and beyond anything that we would talk about with the reduction in transmission of viral particles. There are many studies, most recently the CDC even put out some data just 2 days ago showing that wearing routinely an N95 mask reduces risk of acquisition and transmission of respiratory viruses by up to 85%, which is not 100%. And so then the doubters will sit and say, well, it's not 100%, why bother? Well, like any risk reduction, like wearing a seatbelt or having airbags in your car, it reduces the risks. As far as wearing masks, then we get into political conversations of where do you need to wear the masks? Who's going to enforce wearing the masks? Is it going to be in a public place? Is it going to be in a place of education, a hospital, etc.? And I'm just the doctor, and as an infectious disease doctor, I can certainly recognize the nature of contagion and how things can be transmitted and how reduction of transmission can occur. As far as isolation, really, the lessons that are being learned is how little was really known about transmission of respiratory viruses. This is the first time in human history that people have been getting tested for the same respiratory virus on a routine basis, sometimes even twice a week. So when we are picking up all these positives, this is something we never did before. We never did this with the flu. We never did this with the colds like rhinovirus or enterovirus. And so we're still trying to figure out what all this data means. And so there are some saying that isolation should be done at patients who are positive, who are unvaccinated. Some are saying, wait a minute, vaccine may not reduce transmission, but wait a minute, it may. And the data are coming. Science is never fast enough, it looks like. And so we're trying to get the data as quickly as we can.
So we hit the topic of young people, but what would you recommend for older individuals who do contract COVID right now and who are experiencing severe symptoms? And is the Pfizer pill ready and available?
The Pfizer pill, and then there's the Merck pill. So there's two pills, and they both have unusual names. Molnupiravir, which comes after Thor's hammer, is the one medication, and then the other medication is less available and actually extremely hard to get. The Molnupiravir was rolled out across the country and seems to have at least a 30% risk reduction in hospitalization. This does not sound like a large number, but actually if you had hundreds of people going to the hospital, if you reduce the number by 30%, then that actually would be effective. And it's only with 5 days of treatment in the setting of early symptoms, regardless of vaccination status. So if you feel crummy with viral symptoms, with aches, pain, runny nose, nausea, headache, fever, but are not requiring oxygen, then this medication can be useful and as a result has been recommended on what's referred to as emergency use authorization. That doesn't mean that you can get it anywhere, and there's actually a list provided by the state of Texas on what pharmacies can provide this medication.
Okay, so moving more towards the vaccination side, a lot of parents are concerned about their children getting the vaccine due to long-term side effects. What would you say to those parents?
The concerns for pediatric safety regarding vaccination is reasonable, as parents always want what's best for their children. But the incorrect conversation is, if I vaccinate my child or if my child doesn't get vaccinated, really the conversation is, if my child gets vaccinated or if my child gets COVID. Within 2021, the leading cause of infectious disease death for children under the age of 18 in the United States of America was COVID. It was less than 1,000 children, but it was a number. And it is a bigger number than deaths from other vaccine-preventable diseases such as measles or diphtheria. So parents need to really look at it as that kind of a conversation. The other thing about long-term effects are actually well studied in viruses and vaccines. And vaccines, when it comes to vaccine safety, when vaccines have been studied over the last 300 years, when vaccines are looked at as far as safety data is most important within the first 6 months. There is a strange accusation that vaccines cause long-term issues, and it doesn't make sense. However, in social discourse, even if something doesn't make sense, it turns out that when things get brought up, it can be very difficult to reassure individuals if you dismiss those concerns. So you have to then come up with additional data. Long-term data as far as the safety of a COVID infection. What is being shown in children under the age of 18 when they get COVID is up to 10% of children in the United States are now demonstrating manifestations of long-term COVID, long COVID, and it has a variety of names. They have inability to go to school. They can't concentrate. They can't compete athletically. They actually have evidence of what's called myocarditis from the actual infection. The infection is vicious, needs to be avoided. It is not a safe infection, and that's really the way to frame the conversations about vaccines.
So more so on the social side, do you have any recommendations for just dealing with friends, family, or doctors who aren't vaccinated in your life?
Vaccine hesitancy is really a fascinating phenomenon and is probably a consequence of the successes of vaccines. When you consider that 100 years ago, whole cities were shut down because of a smallpox outbreak, and people saw individuals suffering and dying in front of them from smallpox, there was a real fear for smallpox. There is less of a fear for infectious diseases because of how successful vaccines have been. In fact, when you look at life expectancy in the United States, in the year 1900, life expectancy was 39 years. Now it is over 80. And the single most important intervention for that has been vaccines. However, nowadays, because of these successes, there's a thought that maybe vaccines really aren't that needed anymore, and maybe they actually might be causing some sort of harm. When you talk it over with individuals who are vaccine hesitant, it seems in many cases that they have actually made their minds up and nothing will change their mind. This is very difficult because this isn't scientific. This is more sociologic and political. This is going along the conversations of how do we address these kind of sociologic barriers to the evidence. Because if you show the evidence to some of these individuals, they will not accept the evidence regardless of the science. Is this a consequence of knowledge deficits? Are these individuals not aware of scientific concepts? Immunology is difficult. There are people who study immunology with PhDs that have taken 10, 12, 15, 20 years of knowledge to really understand immunology. So it's difficult to kind of communicate these kinds of concepts within a 30-second soundbite, if you will.
Okay, just to sort of wrap everything up, what have you learned working through the challenges of COVID-19, and what do you think the future of COVID is?
The future of COVID. Well, really what we are dealing with is when an epidemic occurs in a pandemic setting, there are elements of the actual infection and then also elements of human behavior. This combination is what leads to the pandemic and its successes. And the lessons that are learned are scientific as well as anthropologic. We have to look and see how humans behave to what happens from the virus. And then the virus adapts. This is not the first pandemic. Looking at pandemics. So, for example, the last real human being changing pandemic was HIV. It turned out in the 1980s, what happened with HIV was completely mind-blowing because there were so many things about HIV that were not known. Children were kept away from playgrounds because parents thought mosquitoes would transmit HIV to their children. Turned out not to be the case. It took lots of research to prove that HIV doesn't exist in the saliva of mosquitoes. So moving forward with COVID, what's going to happen is we are not going to go back to a world that is pre-COVID. We are now in a world that is post-COVID. So as we are in this post-COVID world, we then will see things that will be different. For example, will people ever go to hospitals again without masks? Probably not. Other things that may happen. What are schools going to do? Are schools going to always have this virtual alternative where children can log in and do things through their phones or whatever? Most likely. So we're having different ways of connecting with each other as we continue to adapt.
With that, do you have anything else to say to our viewers?
This is a great honor to be able to be part of these conversations. Education is key as we move forward with this. When we talk about pandemics, and this one particularly, I actually like to make a simple little plug for the vaccine. The vaccine is made in America with American science and American know-how, and actually the efforts to create the vaccine are analogous to the Saturn V rocket. The landing on the moon was an accomplishment that required thousands of scientists to collaborate together, and the achievement was then 2 men walking on the moon, which was amazing. So yeah, we have 2 vaccines, and they are amazing. The vaccine safety is amazing. The vaccine has been studied and followed in several billion doses. We have such robust mathematics to go behind the vaccine, and it is clear that the vaccine is a tremendous intervention and life-saving therapy to be provided to prevent this horrible disease.
Thank you so much for your time, and thank you to everyone watching. We hope that you enjoyed, and we hope that you have a great rest of your Sunday. Thank you.
Thank you so much, and don't hesitate, vaccinate.